This is Office Hours with SIU System President Dan Mahony, a monthly podcast that explores what's happening in and around American higher education. And now your host, SIU System President Dan Mahony.
Thank you for turning into Office Hours. I'm your host, SIU System President Dan Mahony. In this podcast, we're exploring the roles of schools of medicine in developing the healthcare workforce and improving healthcare in our communities. The SIU School of Medicine includes several major parts. It is a publicly assisted medical school preparing doctors and other healthcare professionals. It also has an active clinical practice focused on healthcare needs in the lower 66 counties in Illinois. The work includes hospital partnerships in central and southern Illinois, as well as our federally qualified health center, FQHC, clinics. In addition, the SIU School of Medicine is engaged in world-class scientific research that will impact the future of healthcare locally and well beyond that. We're thrilled to have two wonderful guests on our podcast today, Dr. Chris McDowell, who is the Executive Associate Dean and Professor of Emergency Medicine at SIU School of Medicine, and Dr. Jayna Patel, who serves as SIU Family Medicine Clinic in Taylorville, Illinois. As we get started, I'd love you both to tell us a little bit more about yourself, why you decided to go into medicine, why you chose to work at SIU Medicine, and one other interesting thing that people may not know about you. So I'll start with you, Dr. McDowell.
All right. Well, first of all, thank you very much for the opportunity. I've been looking forward to our conversation. I grew up in Quincy, oldest of four kids, and my parents are educators, so I thought I would be an educator. But really, I had two seminal experiences that kind of changed my trajectory. One of my brothers was diagnosed with type 1 diabetes, and we were very close. And as I learned more about his illness, I spent some time with his pediatrician, did a little shadowing in the hospital, and I was pretty intrigued. And then I got a job in college drawing blood as a phlebotomist, and I was really hooked. Healthcare was going to be my thing. But I wasn't sure about medical school, so I actually went to school to be a physician assistant. And after I completed my education, I worked for a year in Pittsfield doing family medicine, and then went back and taught at the PA program at Finch University for 2 years on the faculty. All that time wondering about going back to medical school, and then finally came back to SIU School of Medicine in 2001. When I graduated in 2005, I left to do emergency medicine residency in Indiana and kind of thought, like a lot of people, my Springfield chapter had closed. And then I got this incredible phone call that they were going to start a residency program. Would I want to come interview to join the faculty? And I still remember coming over here. We had 3 young kids. My parents came to watch the kids and looking at my wife and saying, they're going to be successful. And if I don't say yes, I think I'll regret it forever. And 18 years later, here I am. So it's been a fantastic opportunity. Probably the one thing that not everybody knows is I actually met my wife in PA school. So clearly one of the best things that ever happened to me. And I have to say that she looks stunning in the cadaver lab.
All right, Dr. Patel, can you tell us a little bit about yourself and how you got here?
Yes, thank you for having me. I always knew I wanted to be a physician, so it was just what kind of physician. I always said I was going to be a kitty doctor, so a pediatrician, because I loved going to the doctor. But it wasn't until college where I realized I didn't only want to take care of children, but family medicine wasn't really a specialty that was very much present in my community growing up, so I didn't know it existed. But then I realized, oh, there is a specialty where you can take care of everyone through all walks of life, and I was very interested. And that was solidified when I went abroad, and I volunteered in Peru, and pretty much everyone there practices like a family medicine physician, so women's health, obstetrical care, pediatrics, geriatrics, everything, and I just loved it. So when it came time to go to medical school, I was pretty much already set on what I wanted to do. It was important for me to go to osteopathic medical school because I also wanted to have a hands-on modality to help treat my patients, and that was also from going abroad. Patients couldn't afford medicine. They were begging for the equivalent of 1 penny just for one pill, not the whole prescription, just one pill. So I wanted to have something to offer that was more than just a prescription. And so I went to school in Arizona, and that's where my love for family medicine solidified. Every single rotation, I just loved every aspect of it, and I knew family medicine, I get to do it all. So when it came time to go to residency, I wanted to come back to the Midwest. That's where I'm from, and so I matched at our program here in family medicine, and it was also important for me to stay at a federally qualified health center. I picked my med school because we train at a federally qualified health center, because my passion is to serve the underserved and ultimately go abroad. So SIU Family Medicine, I trained at FQHC, and now I get to continue to work at an FQHC, but at our Taylorville site, which is more rural.
Yeah. Well, and I think it's interesting, too. We talk a lot about our medical school students and hoping they stay here, but our residents is another way that we help to support the workforce here and bring people into medicine. Dr. McDowell, many public university medical schools were created to serve a specific purpose or identified need. What was behind the creation of the SIU School of Medicine, and how do you think that's impacted its development?
Well, it really was to do exactly what its mission is, to meet the healthcare needs of the people of Central and Southern Illinois. And I think, 55 years ago when Dr. Moy came as the founding dean, he really was an educational maverick and found a lot of young rising stars in their disciplines to join him to build a medical school that would focus on clinical education. We take that for granted here at SIU, but that was really unique in 1970. Most medical schools focused on research primarily. We were always set aside to be different. And I think the school took that to heart and became internationally recognized for its medical education approach. And we continue to innovate on that front today. And I think it's important for us to make sure we remember that heritage as we move into the future.
Yeah, and I think it's interesting. We had a discussion on our last podcast just about how education has changed. And this is really one example of, even back in the 1970s, they were trying to do some things different in how they were educating doctors. Getting into medical schools is highly competitive. I know it is intimidating for a lot of people. Certainly when I thought about that, it was like, that's going to be really hard. Dr. Patel, tell us about your experience as an applicant, how you learned that you made it into medical school. And so we'll start with that.
So I probably was a little bit more untraditional. I definitely took the MCAT, got a good score, applied to medical school, and I didn't get in the first time. But it was the biggest blessing in disguise. At that time, I knew I wanted to be a physician. I just didn't know what was missing. And that's when I realized osteopathic medicine is what I was missing. I wanted to be a physician, but I wanted to have something more. So the second time around, I applied to only DO schools. And that's when I got in. And it was definitely a nerve-wracking process, especially since the year before I didn't get in. But I just spent that year actually enjoying college. I loved studying and continued my study, but also started researching more and spending more time doing things that I also liked, because I knew, well, maybe when I'm in medical school that won't be fostered. So that's how I ended up deciding to go to DO school. And I remember I was scribing, so I was a medical scribe while I was also researching. And I finished a really tough shift. I walked out and I got the email that I got accepted into my first medical school, and I went running back to try to find somebody in the department that was still there, but I was the one burning the midnight oil trying to finish my provider's notes. But the next day was really exciting to share that I got into my first school.
Oh, congratulations on that. And I think that's an interesting thing, too. So many doctors I've talked to, highly successful doctors who didn't get in the first time around and learned something or did something different the second time. And yours story is a great example of that. Dr. McDowell, can you talk about what you look for in the admissions process here at SIU School of Medicine and how that really relates to producing good doctors?
Sure. I think we are careful to make sure it's a holistic process, because we need to meet the needs of our patients both in and outside the clinic. And so what does that really mean when you break it down? Of course, as you'd expect, we're looking for academic rigor with people's success in their undergraduate work as well as their success on the MCAT. But we also want to see what's their commitment to healthcare. Do they have healthcare service in their background? Have they investigated the career? What's their community service? What do they do outside of school to show us that they're going to give back, which we expect of our physician graduates of SIU School of Medicine? In addition to that, we're also looking for people who will really serve the mission of this school to meet the needs, especially of the patients in Central and Southern Illinois. And we think all of that together makes the most well-rounded physician, and we're proud of that.
Yeah, no, I think it's good for people to understand that. I would say when we accept 80 students in every class, there's considerably more who probably meet that first criteria of having enough academic rigor in their background and enough intelligence to do well. And then it's all those other things that really make the difference between who the 80 are and who's not accepted. The SIU School of Medicine obviously plays a large role in healthcare here in Springfield and across the state, particularly through the FQHC. Dr. McDowell, can you talk a little bit about the ways we are directly involved in providing healthcare and how that might compare to other medical schools?
Sure. We have a practice of SIU Medicine or SIU Healthcare, and that's where we provide our patient care services. And it's a very robust array of services. It's outpatient work in primary care, it's outpatient subspecialty care, and it's inpatient work across all domains of medicine and surgery and beyond. And so we really provide a full gamut of services. So if an individual or their family is looking for care, they can come to SIU and get almost all of their needs met from our providers. But in addition to that, we do some other things in the community as well with community health workers and that to really bridge the gap from what I do for a patient in the emergency department to getting them to their primary care appointment, maybe with Dr. Patel. There's a lot of things that have to happen in between there. And we are growing our community health workers group so that we can help provide those services as well, because we recognize that there's a lot of social drivers of health that are important for us to pay attention to too.
Yeah, so it's not just the treating the patient, but trying to prevent some of the problems as well is, I know, a goal for us.
Absolutely.
Dr. Patel, can you tell us more about the FQHC and the different ways they provide care in Central and Southern Illinois?
So as a federally qualified health center, we focus on treating the underinsured and the uninsured, but that doesn't mean we don't treat private patients. So we can take care of anyone. And if they don't have the insurance or the money to afford a doctor's appointment, we have a sliding scale fee to really make sure that you as a person can get quality medical care. And that comes down to also covering certain lab services and imaging too. That sliding scale fee also helps with that. So it really helps provide care to patients. And in areas where there are more rural communities, like where I work in Taylorville, there aren't that many places that are open for them to have care, or if it is, they're driving 45 minutes to an hour to get there. So it's nice because it's a little bit of a one-stop shop. We have a lot of services that we can offer. Dr. McDowell mentioned the community health workers. They also help a lot with that too. So if you're having housing insecurity, transportation insecurity, food insecurity, there's so many things that they can help with, but the community health workers help provide those resources or get you in contact with those resources. So to really make sure that coming to the doctor's appointment is only a part of the equation in your overall well-being. It's making sure the lights are turned on so you can have good hygiene practices and can see what you're doing. The water is turned on. Do you have food to nourish your body and heal from within? So it's really trying to make sure that we're taking care of the patients holistically and meeting them where they're at and helping fill in gaps where they might need extra assistance.
And I think you may have hit on some of this, but given your practices in Taylorville, tell us a little bit of what it's like working in a small rural community that may be different than what others might experience in other locations.
So I feel like I have pretty good insight considering I trained in Springfield with the residency program, but then I'm practicing in Taylorville. So we're FQHC at both sides. So everything I just mentioned is still in place. We have a community health worker and all those other resources. But Taylorville definitely in more rural communities is kind of a catchment. So it's not just people living in that town. It's a lot of the neighboring towns. And for a lot of my patients, Springfield's a big city. It's a 45-minute, 30-minute drive from town, but that's too far for them. So really they're relying on you as a primary care provider for everything. So in Springfield, it was nice. I had my colleagues close by in other specialties. I could help get them in, but my patients in Taylorville, they can't always make it there. So while I can reach out to my colleagues in other specialties, I'm primarily doing a lot of the workup, which is good because patients are getting access to care. In other areas, they might not be getting that. So that's probably the biggest thing that's helpful. And then for us, we also have a van service to help provide transportation too. So if it really is a patient that is complex, that is beyond what I can do as a primary care provider after doing the initial workup or the follow-up imaging, or they don't want to go to the ER because they are afraid to go to the ER. I did all that workup and I'm like, this is really serious. You need to see the specialist. The van helps provide them transportation too to limit the gaps in care that they could have if they didn't have that.
Yeah, and it seems that transportation can be a major issue for a lot of people. And it's funny, I grew up in a rural area, but we weren't that far from a hospital, and I just took that for granted. And now that I've lived in other places, I realize what a luxury that was to have that. It was 15 minutes away. It was really, really close. But for a lot of people across the southern part of Illinois particularly, sometimes it's a much further distance. And you say the more serious it gets, the more help they need to get to the care that they need. And related to that, a few years ago, we started the Institute for Rural Health, which focuses on increasing our impact on rural health in Illinois. Dr. McDowell, can you discuss kind of some of the goals of the Institute and the ways we're working to achieve those goals?
Sure. I think we're really hoping to leverage the collective strengths of the system. So bringing SIU Carbondale, SIU Edwardsville, and SIU School of Medicine together to provide improved care for our rural populations. When we talk about this, we kind of talk about it in 4 buckets. The first one I would say is educational programs. So what are ways that we can pool resources for educational programs that meet a new need, or perhaps help us with the second bucket, workforce development? Many of our healthcare institutions are struggling from a workforce standpoint. They need more nurses, more ultrasonographers, and the list goes on and on and on. And we believe that the SIU system and our programs can be part of the solution for that. And we think the Institute for Rural Health can help us target where we can grow new programs and meet some of those workforce needs. The third bucket is around research. And I'll just give an example from my own world of emergency medicine. Getting patients from a rural hospital to us in a larger referring hospital is hard by either ground EMS or air transport. So we need to do some research around these same challenges that we have all across the United States, and what's a collective solution that we can offer and then share with the academic community that they can learn from what we do in Southern Illinois. So a very powerful opportunity there around research. And finally is really offering more clinical services to patients in rural environments. And I think digital health provides a really exciting way for us to do that in a telehealth strategy and some new ways to get patients the specialty care that they need without having to travel until the procedure or until something that really does have to be done in person. Most of us have had those experiences with family members who have to travel long distances at some point for healthcare. That's a real challenge for a lot of families and a lot of communities. So those 4 buckets, I think, are our opportunity, and I think we can have a big impact.
Yeah, and I'll just kind of build on the telehealth. I think that's certainly one of the things that came a lot during the COVID period, but we found was highly effective and really wanted to maintain and grow significantly from there. But all of those areas I think are exciting and really fit into our mission to help out the rural communities as much as we possibly can. You mentioned just a little bit about research, and that's certainly one of the roles that the School of Medicine has. Can you talk about some of the exciting ways that SIU School of Medicine is advancing health-related research?
Yeah, we're really trying to use research and discovery to do 2 things. One, to improve patient care and also bolster our own reputation nationally so that more people know about the great work that's done at SIU School of Medicine. And there's a couple places where we do this in a really targeted fashion. We have our upcoming Denim and Diamonds with Simmons Cancer Institute, and we do a lot of research around cancer. And one of the places where we do a lot of impactful research there is our health transformation grants, where we really use team science to find a small idea and see if it has some merit to actually grow it and apply for a larger NIH grant. And we've had some real success with taking young learners, young researchers to actually start to develop their careers in that model. We've had some good success from our Smith's Alzheimer's Institute, a lot of success for many, many years around tinnitus, hearing loss in the field of otolaryngology, and many, many others. Our research enterprise continues to grow, and we're especially proud of the new R1 designation with our colleagues in Carbondale. I think that's really a signal to the academic community that the research here is robust and that we want to continue to grow that.
Yeah, and I think you identified some of the really strong areas that we have. And we see that a lot with medical schools where they try to focus on at least some areas that becomes one of their specialties, and we certainly have tried to do that here. Dr. Patel, how important is ongoing research to the medical community at large and doctors like you who are serving patients in the field?
Research is the way forward. It allows us to come up with new treatment strategies or understanding medical problems or even things like social determinants of health and how they impact someone's care. It's things like the new injectable medications for GLP-1s for weight loss diabetes. Those weren't really that, I didn't learn about those that much in medical school. Right. It was a brief breeze by, and then all of a sudden I'm prescribing them almost on a daily basis. That's a short turnaround time. So research is important to continue to move forward, better care, and things that might have been untreatable in the past now have treatments. We have cures for hepatitis C. We didn't have that back then. HIV can be pretty well managed where it's not really a death sentence. You can have a very long, prolonged quality of life. It's with research that provides all those changes to happen, and then in turn I can help my patients with their health journey and their overall well-being. Yeah,
and I think you hit on too. It's for you who maybe wasn't educated on these things when you were in medical school, and probably the same for Dr. McDowell. I mean, you then need to both have that research, but also be able to read that research and feel like this is something reliable. This is something I feel comfortable prescribing to my patients. And so good research can be beneficial in multiple ways. Everything we've been discussing obviously is costly. Medicine is costly in a number of ways. And so while some of the operations that we have are supported by student tuition and fees and clinical revenue, much of it must be covered from other sources. So Dr. McDowell, can you talk a little about the areas of funding support that we receive and why this is important in achieving the outcomes that we want?
Certainly. So the biggest driver of revenue for us is our clinical practice. Mm-hmm. And that allows us to not only see patients, but also provide some of the other things we need to do as a full-service medical school. The next piece is support from our community hospital partners, the bulk of which comes from Hospital Sisters Health System and Memorial Health System here in Springfield. And the reason that's important, as a community-based medical school, which we are, we don't have our own academic health center. So we rely on the support of these hospital systems that we work with. And we work with other systems across the region in Illinois as well. But they provide a large portion of our funding as well, and that relationship is crucial to our success. Next would really be research and grants that we earn as faculty and the continued growth there. And then really finally, in addition, of course, to tuition and fees, is philanthropy. And I think we have had significant growth in our philanthropy success over the last decade, but those gifts are transformational and they really allow us to do things as an institution that we couldn't do any other way. And it's really an important thing for us to continue to manage all those sources of funding so that we can provide the best education, the best patient care, and really the best research opportunities for our faculty moving forward.
Yeah, and you've hit on all of those. I think what is interesting to me too is obviously research funding has gotten a lot of attention in the media recently, and it's without the money to support that research, we can't do some of the things that Dr. Patel was talking about, and even the overhead costs are really necessary to build up a research enterprise that can support that research going forward. And certainly we have a number of patients who get support from Medicare, Medicaid, all of those different sources. Certainly in the region we live in, sometimes that's even more critical. So, federal support is certainly a big part of what we rely on in order to be able to do the work that we do. One final question to both of you. As you look forward, what are some of your aspirations for the SIU School of Medicine, and what actions will be needed to achieve those goals? And Dr. McDowell, I'll start with you.
All right. I think the easiest way for me to think about this is to kind of break it down into the pieces of our mission. The first one being education. We've got this really strong heritage of medical innovation around the way that we educate future physicians. And I've got some colleagues doing some very exciting stuff with the field of AI right now to help us advance what we do in terms of individual training before you see a patient, to improve actual clinical skills, surgical techniques, what have you. It's an exciting time, but we really want to continue to grow that reputation. Second thing is patient care. The better job we do meeting our patients' needs provides better educational experiences for our learners. Everybody benefits from that. And our practice has grown about 60% in the last 6 years. We will continue to grow to meet the needs of our patients in the region and bring them really the best care. We're committed to that. The third piece is research. And if you say aspirational, I would say my aspiration is we sit in the middle of the Mid-Illinois Medical District. I'd love to see SIU School of Medicine champion a partnership with some of our other healthcare colleagues in this community to bring some new tenants to that medical district that would benefit research as well as all the other economic things that those folks would bring to our community by relocating here. I think it's a real opportunity for us. Lastly, community service. We have to be able to give back as part of SIU School of Medicine. We're grateful to the support we have from the community. We want them to see us on their boards. We want them to see us volunteering. We want them to feel our input and impact in a lot of different formats across the community. And I think that Dean Cruz has done a very good job of elevating our profile in the last decade here at SIU School of Medicine to do just that.
Yeah, and I think, one example of that certainly was the request that he got to chair the Massey Commission. I think that's just one of many places, but it's interesting, having lived now in Springfield for a little over 4 years, the number of times I'll go out someplace and people will talk about, well, this person, Dr. Elamine was here working on this thing or whatever it is, that the School of Medicine comes up quite frequently and what impact it's having, again, beyond even the things we really focused on of preparing medical students and providing clinical care. Many of the ways we're having an impact goes well beyond that. And I will point out, for those who are interested in what you were talking about related to AI, Pinckney Benedict was on one of our earlier podcasts. And so if you haven't listened to that, you can go back and listen to that. And I was just fascinated at how much it had changed even from the first time I had seen a presentation where it was kind of this generic patient. But now it's like, okay, but it's different if you're treating a 12-year-old and it's different if you're treating someone whose English isn't strong. Like all of those things we can program into AI and really give the students a chance to kind of work with a patient like that. This was fascinating to me. So, Dr. Patel.
I definitely want to echo what Dr. McDowell said. Everything is definitely what I also agree with. And to build off of that, just from somebody that works with a lot of medical students and also residents, I just want these amazing opportunities to continue to grow. We have really renowned specialties in our area, which maybe you don't think of it being in Springfield, Illinois. We have that, but our fertility center, our REI, reproductive endocrinology, like there's so many, in our cancer institute, there's so many things that are just coming out of SIU School of Medicine that our medical students and our residents have these amazing learning opportunities. And further building with other partners in the community, those learning experiences can continue to grow. And as they continue to grow, they bring back things to me that even I was unfamiliar with, which is just this collaborative teaching, growing effort. And medicine is just a profession of lifelong learning. So I'm just excited to see how they continue to grow and help me grow and better treat my patients.
Yeah, and talk about some of the amazing things. I don't know how many times I've heard Dean Cruz talk about the reattaching of hands. So now I know if my hand gets cut off exactly where I'm going to immediately. But again, it really is fascinating, the things that we can do now that, again, were not possible years ago. So I'm going to finish up and talk a little bit about, this is not the first medical school I've worked with. I was at the University of Louisville early in my career, and as someone coming from an entirely different discipline, for me, medical schools were about educating doctors. And that was really about all I understood of their reach and what they did. And when I was at Louisville, I obviously learned a lot more, particularly when I moved into upper administration and saw what was going on there and how much of a focus what we were doing in the School of Medicine and in our hospital and everything else was impacting the institution. But I will say if you've worked at one medical school, you've worked at one medical school. It was a very different medical school. It had a very strong metropolitan urban focus. It had its own hospital. There were different things. So when I came here, it was a very different type of medical school in both how it provided the education, what its focus was, what its goals were. And so it's been fascinating for me over the last couple of years to learn about it. So I want to thank both of you for taking time to talk with me and educate our audience a little bit about what SIU School of Medicine does.
Thank you.
Thanks for having me.
As we wrap up this episode, I want to acknowledge our production team on the Office Hours podcast, SIU Edwardsville graduate student Solomon Amandi, and Jason Church at WSIE Radio on the SIU campus for his guidance. And last but not least, thank you to all of our listeners for carving out time to listen to us. Thank you so much.
Be sure to join us next time on Office Hours for further conversation with the people who work in and study higher education. Special thanks to Kara Baldus-Merriman and Daniel Merriman for the use of their composition Writer's Block as the Office Hours theme song. And thank you for listening to Office Hours with SIU System President Dan Mahony.